Hi, my name is Dr. Doug Steffi. I'm a developmental and behavioral optometrist with a master's degree in education. In this video, we're going to talk about migraine headaches, other chronic headaches, and motion sickness. There's a pretty good chance that even if you can see 20/20 with glasses or contacts, or even without glasses or contacts, if you have a history of migraines, other chronic headaches, or motion sickness, you have an undiagnosed vision problem that you didn't know anything about. So how do I know that? Well, our two eyes are really designed to be used as two global positioning satellites. And if they're not in synchronous orbit, your internal map quest is going to be off. And that's going to hurt. You're likely to have eye strain, eye fatigue, brain fatigue, get tired 2/3 of the way through the day, be mentally in a fog a good portion of the time. It may be as simple as you muster your way through the day and that you just come home and you're tired and cranky. That is likely an undiagnosed vision problem. You could tell me that you had an eye exam yesterday, and if you haven't had my kind of an exam, those problems are going to go unresolved, unrecognized, and untreated. There's a pretty good chance you've never seen this. This is called an optokinetic drum, and people with migraine and motion sickness find this particularly disturbing. So if you're looking at this in this video and you think that hurts, that's not a surprise. And it would be even worse probably when I spin it. And many times when people who find this disturbing, they'll feel it in their eyes, in their head, in their ears, sometimes in their nose, throat, chest, or gut, and sometimes it'll actually make breathing more difficult. Look at this optokinetic drum again. And if you find it particularly disturbing, whether it's not moving or worse when it's moving, there's a pretty good chance that we're going to change that in a second. You'll notice that the optokinetic drum now is a little bit darker. And that's because we put a light blue tint over the camera lens. And if you find this more comfortable, you're really the kind of patient I'm looking for, because I know I can help. And then what we're going to find is, what's it feel like when we take the color away? If you feel that worse again, and feel it even worse than originally, we went from you feeling better back to feeling worse, and that's usually more disturbing. If the blue lens demonstration made a particular difference for you, then you absolutely need to come and see me. But even if the blue lens demonstration didn't particularly change your symptoms looking at that drum, we have other colors, we have yoke prism lenses, we have base-end prism lenses, we have oblique yoke prism lenses. Most of those things you probably haven't heard before, nor have they ever been demonstrated, nor have they ever been determined if they help you. If you or someone you know has a history of migraines, chronic headaches, eye fatigue, motion sickness, I believe we have some of the solutions for you.